Welcome to MedEd Bites, micro just-in-time education. Hello, this is Michael again, and I will be guiding you through this educational MedEd Bite. Patients with darker skin pigmentation have more melanin, which absorbs some of the light from the emitter. This absorption prevents the light from penetrating through the tissue and blood to be read by the pulse oximeter and may in some circumstances compromise the accuracy of the oximeter. Several retrospective studies have demonstrated that inaccurate pulse oximetry readings had a disproportionate impact on people with darker skin tones. In particular and most concerning, these studies found that patients with darker skin pigmentation were at risk for occult hypoxemia, defined as a measured arterial oxygen saturation of less than 88% when the pulse oximeter is reading between 92 to 96%. For example, Stoting and colleagues retrospectively reviewed nearly 50,000 paired arterial blood gas and pulse oximetry measurements and found that occult hypoxemia occurred in 17% of black patients versus 6.2% of white patients, a roughly threefold increase. Similar findings have been replicated across other studies. A similar study by Fawzi in 7,126 COVID-19 patients found that compared to white patients, non-white patients were more likely to suffer delayed care or unrecognized need for care, in addition to greater risk of occult hypoxemia. Some consideration of limitations should be kept in mind while evaluating these studies. First, several are retrospective studies. Also, the measurements of SpO2 and SaO2 were measured within 10 minutes of each other, potentially missing oxygenation changes during that time. Another aspect worth noting is that despite only prescription-grade pulse oximeters being utilized, there was variability in the brands of pulse oximeters used, which was not consistent across the study sites. Another key consideration is that race was self-reported, the significance of which we will discuss in greater depth in another bite. Medtronic. Engineering the extraordinary.